we are talking about the joints, your tendons, your the ligaments. Okay. And when we say autoimmune, I'll explain further. But when we say autoimmune, it means that your body has an immune system. And the immune system is supposed to fight against the infection. So when you have a foreign body like bacteria, viruses coming in, then your immune system is turned on and it fights these foreign bodies.
Fights
so that
typically or normally in your interest. On your behalf.
So yes, on your behalf, so that it doesn't harm you. That's the body's normal response. However, in a group of people, this immune system is activated. Although there are no foreign bodies, there's no bacteria, no virus, but on its own it gets activated and it starts attacking the body's the body. So then it can attack the joint, it can attack any part of the body. You can have your kidneys being affected, you can have your hair, the brain, anywhere in the body can be affected by an autoimmune condition. Okay,
great, folks. If you just joined us, Ultimate Health on Joy 99.7 FM. My name, as usual, is Nortey by nature. I infect you this and every Sunday, right? But I've got in the seats a rheumatology fellow in training. She just defined what she does. Now, let's zoom straight. Childhood juvenile arthritis or juvenile idiopathic arthritis. What's that?
Okay, so juvenile idiopathic arthritis, there are 3 words, so I'll break it down. Okay, so when we say juvenile, it means it occurs in children or people under the age of 16 years. Okay, and then when we say idiopathic, it means we do not know the cause. We don't know what is causing it. And when we say arthritis, it is inflammation of the joint. When we say inflammation, it means that there's reddening of the joint. I mean, for people who are light skinned, you can see reddening around the joint. There's warmth. When you touch the joint, it appears warmer than the surrounding or than the other joint. And then it can also lead to swelling of the joint. When we say inflammation also involves swelling. And also you are not able to use the affected joint.
Functionality is affected.
Functionality is affected. That's right. Yes.
So when we say joints, knuckles, fingers, wrists, elbows, ankles, all those things are joints. Right. Okay, so you're nodding your head. There's some bones there. Can they be affected in this thing we're talking about?
For the juvenile idiopathic arthritis, typically no, but it can affect. Once there's a joint there, it can be affected.
Okay, let me unpack this again. All right, loss of function of the joint. The joint is supposed to facilitate mobility, movement. Right? That's its function. So that would be affected. You talked about swelling or inflammation of the joint or the systems of that joint.
So inflammation encompasses swelling, pain, the warmth I talked about, and reddening, and then the loss of function. So those are the 5 components when we talk about inflammation.
Let me confess, I was praying and hoping you leave pain aside. But we'll unpack the symptoms. All right, so you're getting these symptoms in a joint, and then we're typically, or according to the diagnosis or the classification, we're seeing this appear before the age of 16.
Exactly.
That makes it juvenile. Right. Okay. So if it is after the age of 16, what is it?
Okay. So if someone comes to us after the age of 16 with a joint pain, we would still take a history or take information from them to find out whether this happened before the age of 16.
Was it there before?
Exactly. If say they come and they are like 20 years, but they say they've been having the joint pain for the past 4 years, although they are 20, we'll still say they have had juvenile idiopathic arthritis. But if it happened after the age of 16, then we'll have to do further investigation to look out for the possible causes of the arthritis.
Okay, great stuff, right? Don't get it twisted. We want to break it down. We are never in a hurry here. We want you to be on board and move along with us, right? Because sometimes you go in front of a doctor or any other health professional and you're complaining. You think they don't know what they're talking about. So we need to equip you so you become an empowered client or patient and a partner in your diagnosis, your treatment, your management. You partner whoever it is. If you have any questions, concerns, WhatsApp is 055 1111 997. We're live on Facebook and YouTube. This is Ultimate Health. We're considering today, right, childhood. Juvenile, they both mean the same thing. Idiopathic, she says, that means we're not really sure why it comes about, what causes it directly. So idiopathic, arthritis, to do joints and all the related stuff when they become inflamed. And she's defined the scope of inflammation. Involves swelling, loss of functioning, redness, and of course pain. Yep. Any questions? What's up? 055 11 11 997. We're live on Facebook and YouTube. This is Ultimate Health. Okay.
Joy,
Doctor, let me call you Doc Adelaide. Right. So we've understood that.
Right.
Okay. But, again, forgive us, but we tend to associate these things with adults.
Yes.
Now, little kids with joint problems and things, we don't really readily associate them with this.
Yes.
Is this a common presentation?
Yes, it's quite common that it occurs in children.
Okay.
However, the fact that it's happening in children doesn't mean it's juvenile idiopathic arthritis. I'll say JIA for short.
Okay.
Going forward, there are other conditions that can cause arthritis in children. Okay, so arthritis can be caused by an autoimmune condition, which we have mentioned right now. It can also be caused commonly by infection.
Okay.
So usually when you have common infections like malaria, even in an adult, sometimes when it starts, you start experiencing these joint pains at the onset of malaria. Also, infections such as viral infections can also give you these joint pains as well. And then infection of the joint, when the joint itself gets infected, which we call septic arthritis. Okay. And then cancers can also present initially with these kind of joint pains. So once you have a child present with these joint pains, we investigate them and make sure that it's not an infection or a cancer before we finally hone in and say that this is likely to be juvenile idiopathic arthritis. Yes. And usually, go ahead. The pain should have been going on for at least 6 weeks. For JIA.
Right.
Yes.
Okay. So having specialized as a physician and then gone further, right? Almost fully baked as a rheumatologist, right? We need a specialist or a qualified or a person with advanced qualification such as yourself before we can arrive at this, or can it be picked up at the lower levels? No offense to those at the lower levels, right?
They are very important because we need to pick up these children early and start the management early before joint distraction or damage to the joint occurs. Yes.
All right. So if this is, should I say, manifest or occurring in a child and it has not been identified, diagnosed, then it will get worse.
Yes.
Right. And then the joint itself is compromised, or you mentioned damaged.
Yes.
Okay.
Yes.
All right, folks. WhatsApp 055 11 11 997. I like bringing you in earlier. Okay, if it's about blood, then I want you to flow right through the veins. If it's about joints, Charlie, let's move. Okay, get on board 055 11 11 997. We're live on Facebook and YouTube. And Ziggy Badio, my producer, make sure whichever channel platform you use, he sends it to me, and then he will look at me with that. Yeah. You know how you can look at somebody with that tone of voice, which means I should read your messages and pass your questions to my guest. Okay? So WhatsApp is 055 11 11 997. We're live on Facebook, YouTube, and X. And this is Ultimate Health, your ultimate guide to healthy living. If you just joined us, we're talking about juvenile idiopathic arthritis. Arthritis that presents in younger persons below the age of 16. And we have a specialist almost fully baked in the studio to lead our discussion so that we understand. All right? To inform and, of course, to transform. You're most welcome aboard Ultimate Health. Okay, so we've understood all these things. We need to distinguish it from other things with other causes.
Yes.
Especially and particularly because we're saying this one is idiopathic.
Yes.
Okay.
Yes.
So I have a child who stiffness of the joints or complaints. I understand that when it comes to pain, children are not the best proxies.
Yes.
Right? They will not typically complain about pain unless it's very, very bad. And they move along with it. So how does it present in a child? What kind of things will a parent, a teacher, a caregiver, or a professional like you look out for?
All right. So For the arthritis, there are different types and there are different ways that they present.
Okay.
For the JIA. But usually the child, for those who can't talk, maybe the toddlers, you realize that they are not moving that affected limb that much.
Okay.
They can't complain of pain,
right.
but you realize that they don't move that joint frequently. And you as a parent, you also observe some swelling of the joints as well. All right. And you realize that the child may cry or wince their face when you move the affected joints.
Right.
And then depending on the subtype of JIA, there might be associated fever. There might also be swellings around the neck, in the abdomen, in the armpits, and the groin area, which we call lymph nodes. Exactly.
Don't worry, download everything on my listeners are very, very discerning.
All right.
And when they don't understand, they're afraid of me. So they go and Google before they text. So lymph nodes.
Yes,
swelling
lymph nodes.
Under your neck,
under the chin, in the armpits, in the groin area.
Groin area, right.
Yes. And then, again, I said it depends on the subtype of JIA. Sometimes they can also have the abdomen getting big, and then you can feel some hardness in the abdomen, which is due to enlargement of the liver or the spleen. Sometimes too, it can depend on the subtype. Again, you can have fluid accumulating around the lungs or the heart, and in that instance, the child may come with difficulty in breathing, or they easily get tired.
Other related symptoms related to the system or the organ affected.
Exactly.
Okay, great stuff. 21 minutes past the hour of 2 on Joy 99.7. Today's the 20th, right? Yeah, I think it's 20th, huh? Yeah, 20th July. This one says, must your names all start with the same letter for you to be a doctor specializing in the field? Jifade, Adelaide Asante. Hey, man, shut down here off. Who is this? Yana Kaneshi says, Dr. Jifade has been my 4-year-old's rheumatologist for the past 2 years or so, and she's been really, really helpful. Such a great person. I believe just by her association and the recommendation that Dr. Adelaide is a great doctor too. Tuned in and joining in advance. Hey, Yana. So you are rhyming, huh? She says, Jifade, Adelaide Asante. Then you
just
have
a coincidence.
Yes, Nortey Nunipeku or something like that. Yeah, it goes. That makes me a specialist. All right, great stuff. So she's talking about your mentor, your mom, your boss.
My boss.
Yeah.
A mentor.
Great diva, Charlie.
Yeah, very.
On your small things. She's busy doing something with Rotary, so she can't be here. But yeah, okay. So we've understood all of these things, right? So you notice some of these things. If you don't see them, you can also look out for them.
Yes.
Right?
Yeah.
A child will typically compensate. If my fingers are a bit stiff, a bit difficult, right, I compensate with the other hand.
Yeah.
And so on and so forth.
Yeah.
But should I say a watchful, vigilant parent can tease these things out.
Yes. And depending on the joints, if it's the knee joint, then you realize that they limp. Okay. If they started walking, you realize that they walk with a limp. Okay. Or they wouldn't want to play with their peers as much as they used to, because that joint is very painful. All right. Another symptom I forgot to mention is that sometimes they also present with the rash. Okay. The rash may be difficult to see depending on your skin tone. Yeah. So for lighter skinned people, you realize that it's this kind of pink appearing rash. Okay. And I mentioned initially that they also come with a fever. Now the fever, depending on the subtype, it's a special kind of fever in that it happens once or twice in a day. Okay. And when the fever happens, the child appears very sick. Okay. But once the fever settles, they go about like nothing has happened. Okay. And this fever goes on for about 2 weeks. And you also realize, if the parent is observant, you realize that when the fever comes, then they notice the rash. Okay. Once the fever goes away, the rash also disappears. So we say that the rash is an evanescent rash.
Brofo.
Aye.
Hey.
Evanescent.
Please, Ziggy is very, very stubborn. I want him to... What do you mean when you say a rash is evanescent?
It means it comes and goes.
It comes and goes. All. Ziggy, écoutez bien, right? And for my listeners too, right? A rash that comes and goes, all right? What's the other one that begins with PS? Psoriasis, huh?
Yes. Yeah. So I mean, if I can talk about the subtypes of psoriatic arthritis.
Yes. Let's go ahead.
So there are a lot of categories of psoriatic arthritis. The first one I'll talk about is oligoarticular. When we say oligoarticular, it means that it affects less than 4 joints. So maybe you can have just 1 joint being affected, or 2 or 3 or 4, but not beyond 4.
So that is more restricted to a certain number of joints or a certain area.
More number
of joints that are affected.
Yes, but commonly it affects the wrist joints, the knee joints, and the ankle joints. But then once there's a joint, any joint can be affected.
All right. Okay.
Yes, so that's the oligoarticular type.
Okay.
And then you have the polyarticular type, which affects 5 or more joints.
Okay.
Okay. And the special thing about that is that we have 2 hands, 2 legs. So once it affects the left joint on the wrist, I mean the left wrist joint, you also find it on the right wrist joint.
Okay.
That's polyarticular, 5 or more joints. Then you mentioned the psoriasis, or the psoriatic JIA.
Okay.
And usually that's found in children with psoriasis. So they have these rashes usually at the elbow area and the knee. Also they have skin changes in their fingernails. So you realize that sometimes if the parents are observant, they'll notice that there are some small dots or indentations on the fingernails. And then there's also thickening of the fingernails, and with that they also have arthritis associated with the psoriasis. Arthritis related with the psoriasis. That's the psoriatic JIA. Then the next one is it's quite a big word, enthesitis related JIA. So enthesitis is inflammation of the enthesis. So the enthesis is the point where your tendon attaches to the bone.
Okay. Understood.
Great. So when it gets inflamed, then in a child, then you call it enthesitis related JIA.
Okay. Right.
And then
okay, go ahead.
The last one is the systemic onset JIA. That one is the one that presents with systemic features. So you have the fever, the rash, the lymph nodes, the swelling of the abdomen and the liver and the spleen. That's the systemic one. Okay.
When you say systemic, just break that down a little for us.
So systemic means that it involves the entire body.
The whole show.
Yes. But then you realize the other ones that I spoke about, they are restricted to the joints. But then systemic, it's the entire body.
Right, folks. On a Sunday, I'm licensed to be too noon, right? So I ask the questions, but we'd love to hear your questions. WhatsApp is 055 11 11 997. Right? We're live on Facebook, YouTube, and X. Hey, Ziggy is doing sign language. I'll pretend that I can't hear what he's saying, but he's probably telling me one of the platforms I mentioned is not functioning. Is that right, Ziggy? Yeah. Okay. YouTube. Okay, you're right. Well, you try and get us on any of those platforms, and most of them, or some of them, should be functional. Facebook, YouTube, and X. And, of course, WhatsApp is 055 11 11 997. Shortly, I will activate the phone line so you can shoot directly at Dr. Adelaide Asante. Just checked how well baked or cooked she is. All right? The college will examine you, right?
Yes.
Later. But we examine on Ultimate Health on Sundays. When I bring the people, just let them show what they're made of. Okay? Great stuff. 28 minutes past the hour of 2. We're understanding arthritis as it presents in younger clients or patients. Children under the age of 16 are specialists. Let me give her the degree, the qualification. She has said that it's not just the presentation and the symptoms she mentioned. They should have been there for quite a while, a minimum of 6 weeks.
Yes, 6 weeks.
Because other presentations tend to be short-lived. Right, so that is another, should I say, index that can distinguish it from other things.
Yes.
Right, so 6 weeks or more of what we've been talking about.
Yes.
Right, in a child below the age of 16. Right, we're going to be taking history to establish when it first presented. So we're talking more about onset, when it starts.
Yes.
Below 16.
Yes.
Great stuff. We've understood.
So sometimes we call it juvenile onset idiopathic arthritis.
But again, in the interest of helping you understand, okay? Right. And we've understood all these things. All right. Would a pediatrician be able to pick something like this up?
Oh yes, definitely.
Most definitely.
Because more often than not, the children will present to the pediatrician first with these symptoms, and then the pediatrician does the necessary investigations to rule out infections, to rule out cancers, and then the rheumatologists are called in when all these come out negative. Okay. Then we also go on with further history and examination before we finally hone in on the diagnosis.
Okay.
So usually the pediatrician is the first point of contact.
Okay. For many conditions and disorders that I discuss on this show, listeners want to know, for example, can a child catch it from somebody? Even though we've said it is idiopathic and therefore we don't know a cause, is it infectious?
No, it's not infectious.
You can't catch it from anybody.
You can't catch it from anybody, but so there are theories that postulate the possible cause. There's a genetic component to that.
You can, in a way, inherit some components.
Yes.
Okay.
Yes. But then you can have the genetic inheritance, but you need a trigger.
Okay.
Which is environmental.
Okay.
Okay. So these two come into play. So as I mentioned earlier, the immune system is responsible for fighting infection. So when you get an infection, your immune system is activated to help clear the infection. Okay. Now, for people who have the genetic predisposition, after your immune system is activated, it's not it's dysregulated, so it starts acting haywire.
It's behaving by height.
Yes, it's behaving anyhow, even in the absence of the infection.
Okay.
And then it goes on to attack the healthy joints of the body, and that's what we call an autoimmune arthritis.
Okay.
So you need the genetic predisposition and an environmental trigger to start the whole process.
Okay, right, folks. So only X is working for now, as my producer informs me. Right, so we're live on X. Right, FB and YouTube have some kind of autoimmune something is happening there, but Ziggy is in charge of all those things. That's what he's specialized in. So if he fixes it, he'll let us know. Ultimate Health on Joy 99.7 FM. Regards to her ladyship, my boss, Georgina Mensah Dacha, in Kumasi, listening to us. Her ladyship, Charlie, up there, yeah. I think Appeal Court. Right, Justice of the Appeal Court, listening to us. A few of you are also sending messages. I'll read them out. WhatsApp is 055 11 11 997. This is to do with children, okay? Because they are children, sometimes their ability to articulate, communicate what is happening to them is limited compared to the adults. Yeah. So we need a lot. Indeed, when we are working with children, we take a lot of information from caregivers, be they biological or otherwise, right? So we want to equip you so that you know what you're talking about when you bundle your child to the hospital, to a professional, right? That's why we're equipping you, right? Don't say that's what the doctors are there for, right? You should also be able to spot some of these things. Okay. Have we gotten to the point where there's a linkage between all we're talking about and the immune system, right? It's classified as autoimmune, right? So is that to suggest that everything we are seeing and the types we described earlier are all related to the immune system misbehaving and fighting its own self?
Exactly. That is what it's about, JIA. The immune system goes haywire and then attacks itself. Okay. Particularly the joints.
Right. Are there forms, whether they are juvenile or not, of arthritis that do not involve this dysfunctional activation of the immune system?
Can you come again on that?
I'm just trying to say that, can I have swelling, inflammation of any of my joints that is not caused, of course, you've mentioned a few things, that is not autoimmune?
Oh, yes.
Okay, let's explain and distinguish that.
Okay. So when we talk about osteoarthritis.
Right.
Okay. So now that is wear and tear.
You came with the big words.
Oh.
Please go ahead.
When we say osteoarthritis, it's usually mechanical and it's due to wear and tear. Okay. Well, continuous use of a joint. Okay. Right. For the joint, you have what we call cartilage. We know cartilage. We all like chewing chicken with bones. Exactly. Yes. So that one can get worn away or can wear off with repeated use. Okay, and usually this osteoarthritis is usually commoner in the older people. Okay, and then I also mentioned the septic arthritis, which is an infection which affects the joint. Okay, and that one too, you have the swelling, pain, the warmth. The inflammatory process happens in that joint that has been affected by the septic arthritis.
Right.
Yes, and then you also have the cancers, childhood cancers like leukemia. They can also present. Usually bone affects the bones.
So you can have this presentation, and it could be related to an underlying cancer.
Yes.
Right.
Yes, especially the children.
Especially in children. So we need this properly and promptly investigated.
Exactly. Yes.
Okay. Right. 34 minutes past the hour. I don't want to do your course at all. I mean, yeah, it's a lot to unpack.
Yes.
Right?
Yes.
So, on a regular basis, are children afflicted with this? Are they in pain? Are they? Now, you got to sit in school, carry those, I don't know what to call them, backpacks or parachutes or whatever they carry. And you've got this going on. What's the typical life of a child suffering from this like?
Okay.
You know, are they always suffering, or is it in bouts and episodes? How does it manifest?
Okay, so usually these autoimmune conditions, there are flares and then there are remissions. So remission is when the disease is quiet. Okay, and then flares is when you have a sudden attack. Okay, and but if, let's say, if the child is not undergoing treatment, then they have these flares very frequently, and it can lead to missed school days, and they wouldn't like to play with their colleagues, and with the adolescents, it can also have an effect on their mental health as well. Yes.
All right, we're understanding that. Okay, so my dear Dr. Asante, I've heard you use a couple of times in the show management. You've also used treatment, right? I'm African. I'm looking out for cure, right? Before we get into treatments, and is it something that can be cured?
Okay.
Conclusively.
So autoimmune conditions cannot be cured because that is how your body is. So it is managed.
It is managed.
It is managed, not cured. I mean, scientists are still in the lab looking for cures, but as it stands now, there are medications that we use to manage the condition.
We are managing it.
Yes.
So we're trying to mediate, limit, restrict the presentation and the experience of these symptoms.
Yes.
But the thing, ankasano, it is there.
It is there. So once you stop your medications, you have the flare.
All right. Okay. The way she explained it, ladies and gentlemen of the audience, is such that scientists are still checking. And it's not that she's not good enough. She's qualified, but the degree and the level of medical advancement and science limits us to management of autoimmune conditions. Right?
Yes.
We do not talk of cure. And the reason I belabor this point, Doc, and help me with this, is that there are many people going all sorts of places, religious, whatever, and they're being told they're being cured.
Yes.
Right? That is why I go about this. So can we hit this again? Right? That when we say an autoimmune condition, having been professionally diagnosed, is managed.
Yes.
Right?
Yes.
Or treated, but we're not talking about cure.
Yes.
So you can't go to some wine Osofo who shouts in a microphone, wears snazzy shoes and a coat, and says he's casting it out or he's curing you. Can we please clarify that?
Okay.
So that we can go into treatment and management. Okay. Because for various reasons, people stop their treatment or default or are inconsistent because they keep hearing these messages.
Yes.
So that's why I want you to hit on it.
Yes. So again, autoimmune conditions are managed, not cured, because that is the way your immune system is. Okay. So we give the medications to suppress the immune system. We can't take away your immune system. I mean, ideally, the best thing will probably to give you a new immune system, which respects. Okay. But in this instance, we cannot do that. So the medications that we give suppress the immune system. Yes, many a times we have patients coming in, they've deferred their treatment saying that, I heard that this herbal medication is able to treat my condition, and they are away for years and they come back and their condition is even worse off than where they when they were last seen. Others go to prayer camps, they go to bone setters because of course it's a condition associated with joints.
Right.
And then they come back and
it's worse.
It's even worse off than where they started.
Right.
So as much as possible, I would encourage people with autoimmune conditions that be adherent on your medications, and many of them will attest to the fact that when they're on their medications, they feel better.
Right.
And that's another point of temptation. Right. Once they feel better, they think, "Oh, I'm cured," and then they stop. And then
so you need to be communicating a lot, explaining a lot to them and their parents.
Exactly.
As well.
Exactly. Because once the child feels better, there's a temptation that maybe for 2 or 3 years the child has been on medication. The child hasn't complained of any pain or anything, so my child is cured.
Okay.
Then they stop the medications. The next time they come in a worse state.
Okay. All right. 39 minutes past, almost 40 minutes past the hour of 2. We must get into management and treatment. Assumption being, all protocol observed, that it has been properly examined, investigated, and conclusively diagnosed.
Yes.
Right?
Yes.
That is the premise for getting into treatment and management. But let's talk about diagnosis, all right? For many things, we have lab tests that say, hey, we've seen it, you have it.
Yes.
But I understand this is based on clinical presentation.
It's a clinical diagnosis.
It's a clinical diagnosis. Yes. Explain that to my listeners.
So when we say clinical diagnosis, we make the diagnosis, and it's also a diagnosis of exclusion. Because as I mentioned earlier, you need to exclude the infections and malignancies and other things that can present like that.
Right.
Once you've done that, your history, the information that you are given by the patients, it also helps to point out the diagnosis. Okay. With autoimmune inflammatory conditions, the typical history is that they will come in with the joint pain or swelling, which is worse in the morning. Okay, so usually in the morning the child doesn't want to get out of bed. Some of them are even tagged as being lazy. Okay, but as the day goes by, you realize that the pain gets better and they are more active. Okay, and also sometimes the pain is better with activity, and that's one of the telltale features of autoimmune arthritis.
Right.
The pain improves with activity, but when you take osteoarthritis, usually with activity, the pain is bad with activity. But with autoimmune arthritis, once they start using the affected joints, they are better. Okay, and then so the information that they give us also helps. And then on our examination, we notice swelling of the joints that I talked about. You could have swelling of the joints, of the fingers, and there's also stiffness as well with the tenderness or the pain. And we realize that they wouldn't want to move the affected joint that much. So sometimes it can be held in a flexed position. So they'll rather keep their knees flexed than extended or straight, because once it's straight, there's more pain. Once it's in the flexed position, they are more comfortable. Okay, so these are some of the features that we look out for.
Okay, 42 minutes past the hour of 2 on Joy 99.7 FM. We're still unpacking, dissecting juvenile idiopathic arthritis with Dr. Adelaide Asante. If you have any questions, concerns, WhatsApp is 055 11 11 997. I'm going to activate the phone line 030 21 6541 03021 6541. Those are the healthy buttons to push. They shouldn't be stiff, they shouldn't be numb, they shouldn't have a temperature at all, right? 030-221 6541, so you can ask the questions yourself. Right. So doc, okay, we've got all that, we've understood, we've identified, clinically diagnosed this, right? We've been told by the doctor. What happens next and how is it managed?
Okay. So the next thing with regards to management is multidisciplinary.
Okay.
You need a number of healthcare people, as well as even the parents and the caretakers, as well as teachers.
Right.
Okay. So with the healthcare workers, you need the pediatrician, the rheumatologist, you need the physiotherapist as well.
Physiotherapist?
Yes. And then a clinical psychologist is very important, especially those in the teenagers and those in the adolescent ages. You also need the parents to also be involved in their care, because they are the ones who need to be observant to notice the changes and then inform the doctors about it. And then of course the teachers as well. You know, most of the kids spend more time at school.
Right.
So if anything, the teachers would be able to pick up some of these features and inform the parents.
Right. So treatment management is multidisciplinary. She's mentioned the cadres in there, the disciplines in there. I have a caller on the line. Hello, good afternoon.
Good afternoon, sir. Hope you're doing well.
Hey, Ajingo the man.
Yes, I was. I'm very much interested in this topic before. I have a baby who is to get 1 month.
All right, please go ahead and share with us.
Yeah, apart from the infections that we're talking about, is there anything that's been inherited or something?
I didn't go. Hold on a sec. Can you hear me?
Yes, sir.
Okay, please go ahead.
I mean, I was asking, apart from the infections that she was talking about, is there a certain mistake that some of the mothers do that let them get this kind of infections before even they are being born? And also, from which age, a baby from day one up to which age will it be seen that the baby or the child is suffering from this?
Okay, right. Ajingo has put the mothers in the witness box. Is it something that mothers do? He selectively leaves out my fathers, but he's wondering, is it something that goes wrong? Even though we said idiopathic, right? Apart from the infections and other things you mentioned, right? Is it something that mothers may be doing wrong that causes this, right? And then he's also asking, can we pick this up in babies? Very, 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 infants, babies.
Okay.
How early can we pick this up?
Okay. So with the first part of his question, is there something that mothers do that causes the JIA? Mm-hmm. No, it's idiopathic. We can't tell.
Okay.
Okay. But the infections happen. They go to school, they pick up certain infections.
Right.
You need, as I mentioned earlier, you need the genetic predisposition and the environmental factor.
Okay.
So yes, a child may have an infection and not develop JIA because the genetics part is not there. Okay. And to the second question, he asked whether babies can develop. Babies can develop?
How early can we pick this up?
Okay, so sometimes, studies have shown as early as maybe 12 months, 18 months, between the ages of 1 to 3.
Right.
Studies have shown that children can develop JIA. Okay, so once you're under 16 years, you can develop it.
Is it something that, let's say, a physician, a pediatrician would routinely want to rule out? It's not something you're not. Is it something that you're always looking out for?
Not entirely, because I said it's a diagnosis of exclusion. There are other diseases which can present like that. So.
Right. Okay. Great stuff. Listeners, please, we are in session. This is the Parliamentary Special Commission or Committee on JIA, right? Okay. J comes after K, right? Or IJK. No, it's J comes before, right?
Yep.
So after Kutuka, which is KIA, right? This is JIA. That's what we're talking about. Phone line 030-221-6541. WhatsApp is 055-11-11-997. I don't want you to go and pollute somebody with wrong apple. So check what you are thinking by calling us or WhatsApping us, and I push it to the doctor straight before Ziggy sacks me and comes to play music. Right? We have 1 hour. All right. Or what's left of it. Right. So we've understood this. Okay. So what are you doing for this child now identified with JIA, right? Childhood presentation, childhood onset arthritis. What are you doing for this child?
Okay.
And again, I'm asking because when it comes to if it's tablets or anything, children, tablets, couldn't. So what do we do for children who have this by way of treatment and management?
Okay, so usually the first thing we do is to control the pain. So we give pain medications.
Okay.
And for some children, especially those who have the arthritis limited to the children, those with the oligoarticular type, so they have 1 or 2 joints, sometimes we do an injection of the joint. We inject steroids into the joint. Okay. For some children to the pain medications, they may not get better after injection. They don't get better. So that's why we introduce the immunosuppressive drugs. Okay. And those immunosuppressive drugs act by regulating the immune system. So they calm down the immune system so that it doesn't go on attacking itself. Yes. And then sometimes these medications are usually in the tablet form. However, some children do not respond too well to these, so we'll have to give them higher medications like biologics. So biologics are usually infusion, or they can be injections that we inject under the skin, or an infusion. So we set a line. We set a line, it goes through your veins, and then you get the medication. So usually that one, we give you times where you come in for those infusions and injections.
So you're likely to be seeing this child often, or can I say frequently?
Yes.
Over their lifetime.
Yes. So it's important too that they come for frequent reviews.
Okay.
So that we follow them up, because children with JIA develop complications. I don't know if I can talk about that right away. So the common complication is they have inflammation of the eye, or uveitis. And usually that is very asymptomatic. They don't come to you telling you I have eye pain or something. It's very indolent. So the next time you realize
the eye is not a joint,
but it's an autoimmune condition. That's the thing about autoimmune. Once it can affect,
it can go anywhere.
Right. Anywhere. So we follow them up to make sure that they haven't developed this uveitis. So we, in conjunction with the ophthalmologist, who is also part of our multidisciplinary approach, they do regular checkups to make sure that they haven't developed the uveitis. Otherwise, the next time we realize the child has gone blind.
Okay.
Yes.
50 minutes past the hour of 2, which means we've got about 10 minutes. Na Inosu says, what's the difference between lupus and autoimmune disease?
Okay. All right. So autoimmune disease is a broad term, and lupus is under autoimmune.
Right.
So lupus is a type of autoimmune condition. Okay. Yes.
Right. Now I hope that sorts you out. But knowing you'll come back for further and better particulars. Right. Joy FM. It is said that the African is notoriously and incurably religious. You're reminding me of my studies. JS in BT. Right. Is doctor therefore taking out the God factor? That God is healing you completely. Also, since medicines are made basically from plants and plant products, are we ruling out herbal medicine, taking the quantity of active ingredients out? Okay, this is I believe Mr. Labi, a GES retiree, but he's saying, Charlie, when you say there's no cure, you are blaspheming on my show. Can we pack it down? Yeah.
Okay.
And then he brings in herbs and what maybe people call natural or alternative treatments.
Okay.
Yeah.
So what we usually encourage is that yes, we are doing our part, and I mean for us, our faith is also very important.
Amen.
So do not take your faith out, and do not take our medicines out. So you do both of them in conjunction. Okay, we are not saying that God cannot cure you, no. But as you are praying, as you are trusting God, you also still need to take your medications.
God has earth angels like Adelaide,
and He has given us the wisdom and the knowledge to
lay His hands, right? Okay,
yes.
So when you defy Adelaide and co, you are really making God's life difficult. All right, He's giving us the wisdom, right?
Yeah.
Whether you go to College of Physicians or not, it's all godly. Yeah.
Yeah.
Right. You get a title and all that, but when you start to fight, right, what God has put together, that's a nice way of answering this. Okay, so balance them. Yes,
exactly. Balance.
Your faith is there, but hey, God has given you these things, right? And use them.
Yeah.
Right?
Yeah.
Herbal remedies, Doc.
Okay, so with the, before any medication is approved by the FDA, it should have undergone a lot of studies and trials. Okay. On the part of the medications we give have gone through these trials and have shown to be efficacious,
and they are not toxic.
Exactly. But when it comes to these herbal medications, we haven't had the luxury of going through these trials.
Some of them,
right. Yes. As it stands now, when it comes to autoimmune conditions, herbal medications haven't been approved. So we use the approved medications to treat our patients.
Okay, great stuff. 53 minutes, 7 and counting. Do biologics also suppress the immune system? There's a question.
Yes, biologics do suppress the immune system. Okay. Yes, they do.
Break that down. Biologics, what's that?
So, as I said earlier, so biologics are they are disease-modifying anti-rheumatic drugs. Okay. It's a big name.
So are they still pharmacological products?
Yes, they are pharmacological products.
Okay.
But then the peculiar thing about them is that it's given as an infusion or as a drip, okay, going through your your veins, and that suppresses the immune system. The thing about biologics is that for the regular medications, you may have to take them either once depending on the type of medication I give, you may take it once a week or maybe every day. But with the biologics, you come in maybe every 3 months or every 6 weeks for the infusion. So but then they all act in to suppress the immune system.
Right. Okay. So you still be under pharmacology anyway.
It's
and
still
we need to know what those
pharmacological.
pharmacological products are doing in your system.
Yes.
And what dosage and over what time and so on and so forth. Okay. I did a bit of psychopharmacology as well, but I don't get there. Good afternoon, Nortey by nature. Thank you and your resource person. With the pains, is it associated with the normal pains or the very excessive pain? Hey. Gabriel K. Danso, aka Ortega in Dawenya. Ortega wants to know, your normal pain, and
you know, pain is very subjective. So this is quite, difficult to answer because usually we grade the pain.
Let me help you out. How would you, as a rheumatologist, grade a patient or a client's self-reported pain?
Okay, so there's a pain score. There's a scoring she's from 1 to 10.
Okay.
And for children, they're actually in pictures.
Okay.
Okay, so there's a picture for one which shows how the child feels.
Right.
If the child has a smiley face, and then on the extreme, if it's 10, you see the child like crying.
That's the eradicasa stage.
Yeah. So
these graphic representations of pain are easy for a child to use.
It depends on the age of the child.
It's designed to, should I say, facilitate this grading for the child.
Yes. Okay. Yes. So it's very subjective.
Okay.
What someone will grade as 9 and another person may grade as 3. Okay. So
right. Kojo Kumsu says it's necessary. Hang on. Where is it? Oh, scroll. Hey, Kojo. Everything is Kojo Kumsu. So where's what you're saying? It's necessary to put up the mouth. Is it necessary shut because this will distinguish the person from those who bear the same name with her? I guess he's WhatsApping to another program. Typically, I get some of Samson Ladiayen in his law program WhatsApps coming here. Okay, please send that again. I didn't quite understand. This is about RA, rheumatoid arthritis. Nortey, RA is really painful. I've lived with it for over 33 years, right? We'll have to have you back. We'll go into that area.
Yes.
I have a lot of, stuff there, and listeners who want to. Any comment on RA, rheumatoid arthritis?
Okay, so rheumatoid arthritis is also an autoimmune condition, and it's arthritis which happens in the adults.
Okay.
Yes. So that one too, they have the inflammatory kind of pain. Inflammatory kind of pain affecting the joints, usually the hands, associated with stiffness and swelling of the hands, and as she said, it's very, very painful.
Okay.
Yes.
Right. So with these children, you've got your range of tools and treatments. Should I say imaging if you want to check anything and all of that.
Yes.
And you're seeing them over life.
Yes. So usually, we see them over life. Some would transition to the adult rheumatology clinic. So yes.
Okay. Hey, hi me. No, this is about I think the God factor.
God factor.
Now let me read this out, and Ziggy, I've taken a deep breath. Come and take a picture of me whilst I'm reading this. It says, no, the doctor is limited and should please admit and not say God has given them that wisdom to manage. All wisdom given by God are surely limited. I prefer she'd rather say they don't have cure medically and leave it there. Right? And she's speaking within her professional qualification and knowledge. You haven't identified your platform yet, okay? Even fever, Jesus healed it when he visited Peter's mother-in-law. By this, not ruling out medical doctors, not at all. Thank you, KB. Right? We get this. Sometimes there are points of departure.
Yeah.
Okay?
Yes.
We tell you what will help you and what will not help you.
Yeah.
We do not, Doc, agree with me or disagree with me. We do not exclude any other thing you might want to do.
No.
Right?
No.
And indeed, that's the reason why there's informed consent procedure in many things.
Yes.
Right? So what you are sharing with my listeners is not forced
not
on anybody.
At all. No.
And there are people who might refuse it.
You have your autonomy. You can choose to do it or not to do it.
Okay, Katie, we are still friends, I was looking for a Sunday fight, Me, I can fight, but I get your point, and it's well shared. There's actually a module I do with Reverend Dr. Fred Digby on religion and health, right? That's his area of expertise. Many of you might not know, right? We balance that, and then Prof. Hesse, right? Prof. Hesse is an Osofo and a qualified physician in many ways, okay? So we'll bring that back one of these days, so we can have that fight. I'm using fight in quotes. Maybe, I beg you.
Yes.
These days I'm not as mature as I used to be. Okay, so we've got these things available. Must they be seeing a specialist? We're almost out of time, but must a child with JIA be seeing a specialist on a regular basis?
Absolutely, yes. They do have to see a specialist. But, usually we schedule the times or there are review days for them. But in between, if they should have a flare, sometimes their clinic days or appointment days will not be due. So we encourage them that for that they can go to their primary caregiver initially, and then subsequently they follow up with a specialist. So they are some of them are given reviews every 3 months, some every 6 months, depending on the stage of the disease.
Okay.
Yes.
Right.
But they are followed up for life.
Okay, followed up for life. Burden of care. Caregivers are suffering. The child himself or herself is suffering. We know for many of these chronic conditions, there are support groups. Is there anything like that available for these children and their families?
Okay, so there's the TRI, that's the Rheumatology Initiative, which is a support group for people with autoimmune connective tissue diseases or autoimmune rheumatic
diseases. That is where
diseases.
Mamaga...
Yes, that's where my boss.
Right.
Yes, please.
The
so,
Rheumatology
Initiative.
TRI.
Yes, we shorten as
you
TRI.
You can Google that.
Yes,
right.
And they have a Facebook page. They have a page on Instagram. They have a page on X too.
Okay.
So it's Try Ghana.
Great. Right. We tried you today and we loved it. We totally loved it. Right. We might consider bringing you back to cross the border, right? Since when it comes to these conditions, we don't build walls like the Americans want to build, right? But we want to cross into the adult presentations and see, though we recognize and we support you for your juvenile idiopathic arthritis awareness month.
Yeah.
Is there any key thing highlight that you want to leave with my listeners? Dr. Adelaide.
Okay, so what I'll say is that for the children, the caregivers must be very, very, very observant. Like I mentioned, the swelling. If you notice that your child is not as playful as they used to be, you need to be on the lookout for what exactly is going on. Look out for the rash. And also, if a child has been diagnosed with JIA and is on treatment, yes, I know sometimes it can be very burdensome on the parents because financially you have to take time off work, send a child to come for reviews. It can be very burdensome, but once the child is on treatment and the child is doing fine, you have your peace of mind. The child is also all right, doing very well in school. So I would encourage parents who have children with JIA or these autoimmune conditions not to give up.
Okay, don't give up, and God has appointed earth angels like Dr. Adelaide Asante, who's here, right? Yes, we are not blaspheming, we are not denying God's healing power, but yes, there are earth angels like her, and we're most grateful that she's around and she's able to help. Many thanks, Dr. Adelaide.
Thank you very much, Nortey.
Right. How was your experience on Ultimate Health?
Are we off air?
No, I'm talking to you on air. She's asking if we're off air. How was your experience?
Well, it wasn't as terrible as I imagined it to be. I think it was quite smooth.
You actually imagined it would be terrible. Oh, I'm sad. Ziggy, come and take your program. My guest said she imagined it might be terrible. So you're still alive?
Yes.
Ziggy, bring the stethoscope. Come and check her heart. Let's check her and make sure that she satisfies and meets all Ultimate Health criteria.
Oh, I was expecting some palpitations and all, sweating inside the AC, but I'm good.
Yes. Ziggy, she has brought herself. But we are most grateful when we have guests who come in on Sundays and help us, Ziggy, draw closer, help us, educate and empower you. These are not, even if it's childhood or juvenile, this is not child's play. It's serious stuff, and there are people who, go through a lot, right?
Yeah.
There are many other, should I say, more painful, should I say, manifestations.
Yeah.
Right?
Yeah.
It affects a child's schooling, academics, and all that. And so we need to be sure what we're doing with you. Okay, Ziggy has fixed my problem. Let me get out of here with some music.
Glad to be free. You know what I'm saying?
All right, everything's okay. Back to Mary. Yeah. Learn to praise him through your circumstance. We have just done the baptism for Dr. Adelaide Asante, and I'm sure I can wrap her and get her back next week for your benefit. Stick and stay. Don't go away.